Diet alone in most cases cannot cure an underactive thyroid. But eating a thyroid healthy diet can help the thyroid function better and help you reduce some of your symptoms. So in today's video, I'm going to reveal the diet and lifestyle changes that you can make to take control of your thyroid health. If we haven't met before, I'm Maria and I'm a registered dietitian. Welcome to the channel. Now let's get into the video. Now we're going to cover a lot today, so make yourself comfortable. And I have broken down the video into chapters, and there's timestamps for everything below, so you can skip ahead to the relevant section if you want. But I do really recommend watching all of it to get the best understanding of your condition. And I just want to say that I obviously can't individualize this to you and your unique needs and your unique situation. So it can't be taken as medical advice. And it's so important to work with your own dietitian and your own doctor when making any changes to your diet, to your medications, or to your supplements. But hopefully this video will give you some knowledge so that you can then go to your doctor or to your dietitian and you can have an informed conversation. You know what questions you might want to ask and what answers you want to get. But of course, if there is any questions or areas that I don't cover today, please comment below and I will do my very best to answer them or make a follow-up video if necessary. So for a little recap lesson, an underactive thyroid, what it refers to is the underproduction or low levels of thyroid hormones. And our thyroid hormones do a lot of things, but a big one is regulating our body weight as well as our metabolism. So our ability to lose weight, maintain weight, or gain weight. And because of this, common symptoms of an underactive thyroid tends to be unexplained weight gain and a slowed metabolism. But there are many others. For example, an increase in your cholesterol levels or fatigue and feeling sluggish. You might have irregularities in your bowel movements like constipation or bloating or heartburn. And there can be disturbances with your menstrual cycle and then fertility issues. But what I want to also say is that you might not have any of these symptoms because symptoms don't often occur until you are at a more severe level of the condition. And as many as 60% of people with a thyroid issue have no idea. And I really want to highlight this because YouTube tells me that most of the people that watch my videos are female, and women are 5 times more likely than men to have thyroid issues, especially following pregnancy and around the time of menopause. So there are quite a few. It could be that your thyroid is inflamed, and this can happen post-pregnancy. In fact, 7% of women in the first year after pregnancy will experience this, so it's not uncommon. But it's often overlooked because after having a baby, you're going to be tired and feeling fatigued, but you think that's just normal because you now have a child to look after. Or it could be that you have had damage or injury to your head or your neck area. And sometimes an underactive thyroid is brought on by medication to treat an overactive thyroid. There are also certain nutritional deficiencies, like too little iodine and selenium. This can also cause hypothyroidism, but I will say it's quite uncommon. And then on the other hand, if you supplement and if you take too much, this can do more harm than good and cause more issues for the thyroid. This is a great example of why you should always know what supplements, what dose, and why you're taking them. Also, if you are on a really strict diet and you're starving yourself or you're crash dieting, all of these things are going to affect your thyroid if you are in any way malnourished. But the leading cause of hypothyroidism is an autoimmune disorder called hashimotos. And this affects about 5% of the American population. Now, it's not clear what causes hashimotos or autoimmune conditions, but they do run in families, so there is definitely a genetic link. Also, it's common if you have one autoimmune condition, like celiac disease, for example, you are then more likely to also have another. In fact, it has been shown that people with celiac disease are 4 times more likely to develop Hashimoto's than the general population. I'm going to pause here and ask that if you're enjoying the video so far, I would really appreciate it if you hit the red subscribe button below. It really helps support my channel. And if you're looking for healthy, high protein recipe ideas, I'd recommend following me over on Instagram. So if you have a concern that you might have an underactive thyroid, you need to go to your doctor and get checked. And the main way to do this is via a blood test. And an important thing to note is if you take a supplement that contains biotin, which is in many hair and nail growth supplements or many female targeted supplements. You should stop taking these a few days before you have your blood tests taken, because this biotin can impact the readings of the blood test. But this blood test will look at your thyroid hormones. And if hashimotos is expected, they will also be looking for an antibody here too. And I can't emphasize enough how important it is to get a proper diagnosis, because medication plays a huge role in this condition. And your doctor will also need to monitor the condition over time, and doses of medications may need to be adjusted. You might start with a very mild version of hypothyroidism, and this can then progress to full-on overt hypothyroidism. And I will always be one to advocate for the power of nutrition. I am a dietitian, but I want to be very transparent here in saying that diet is more often than not enough. And sometimes in certain situations, drugs are necessary. And this is certainly the case for an underactive thyroid. Now, I want to touch on weight gain for people with an underactive thyroid, because as a dietitian who does a lot in the weight loss space, it's something that I'm very frequently asked about. So when your thyroid is underactive, it slows down your metabolism. And this means your body burns fewer calories. And as a result, some weight gain can happen. For most people, the weight gain is usually modest, around 5 to 10 pounds. However, the more severe the condition is, the more weight gain you may expect, or the longer it's undiagnosed or you're struggling with treatment. It's important to know that some of it isn't necessarily fat gain. Some of it is often due to water and salt retention. And once hypothyroidism has been treated and your thyroid hormones return to normal, the ability to gain or lose weight is the same in patients who do not have thyroid problems. However, let's be real, weight gain is very multifaceted, and it often develops over long periods of time. So it's not uncommon for people with hypothyroidism to struggle with their weight. And if weight gain is a very big concern here for you, I would really recommend working with a dietitian. They will help you set realistic goals. And keeping in close contact with your doctor is also really important, because staying on top of monitoring your thyroid hormones and monitoring your medication can really help. Medications or thyroid hormone replacement therapy is the gold standard treatment for an underactive thyroid. And in many cases, but depending on the cause for the underactive thyroid, this will need to continue indefinitely. And this is done most commonly through the medication levothyroxine. And this medication is taken orally once a day and has been shown to reverse symptoms of hypothyroidism in the majority of patients. Now, it never ceases to surprise me though about the amount of people who are on this medication and have no clue about how to properly take it, because some foods and supplements can really interfere with how this medication works, and therefore how this medication is going to work for you. And some of the main ones to be aware of are calcium supplements, iron supplements, and soy foods. So with any of these, it's recommended to leave a 4-hour gap between them and your thyroid medication. So if you take any calcium or iron supplement, or if you just take a general multivitamin supplement, it's worth checking, does it contain iron and calcium? It probably does. So don't take this at the same time as your medication. Also, many people don't know this, but many antacids or heartburn medications, these contain calcium. So for example, your Tums, your Alka-Seltzer, and your Rolaids. So all of these can block the absorption of your thyroid medications if they're taken too closely together. So it's best to leave a 4-hour gap between all of these and your thyroid medication. Now, the other things to watch out for are your caffeine from your tea and your coffee, and also fiber. And fiber is in a lot of foods. Simply put, it's in plant foods. So your fruits, your vegetables, your whole grains, your nuts, your seeds, your beans. These are all fiber-rich foods. And all of these can also interfere with your thyroid medications. So it's recommended to leave a gap of at least 30 to 60 minutes before you have your first cup of tea or coffee, or having any fiber-rich food, so your breakfast. So being very practical, what's usually recommended is that you try to take your thyroid medication first thing in the morning on an empty stomach. And then you want to wait those 30 to 60 minutes before having a coffee or before having your breakfast. And don't have any soy foods here like soy milk, soy yogurt, or tofu. And then if you're taking any vitamin and mineral supplements, take them later in the day. But if you time your supplements and your foods carefully, you will help your medication work better and therefore support your thyroid health. Now, there is some debate about whether or not you should take your thyroid medications first thing in the morning or last thing at night. And I think it really comes down to the individual and your own morning or your own evening routine. So what I would say is speak to your doctor if you are thinking about changing how you take your medications. But what you need to make sure you do is that you stay consistent. You can't take it in the morning one day and at nighttime the next. Taking them at the same time every day is really important. And if you do decide to take it before bed, it should be at least 2 hours after your evening meal. I'm curious though if you are happy to share if you are taking thyroid medications. What do you do? Do you take them before bed? And what has been your experience about what has worked for you? You can let me know in the comments. Now, nutrients play a significant role in thyroid function, and getting enough of the right ones can help you feel better and more energized. And they can help you combat any thyroid-related symptoms that you might have. And 3 nutrients in particular that are important for our thyroid are iodine, selenium, and zinc. So let's start off by looking at iodine. So iodine is a mineral that our body needs in order to make thyroid hormones. And our bodies cannot make iodine, so we need to get it from our diet. Now, iodine deficiency tends to be rare, especially now as many countries have iodized salt. However, it geographically differs quite a bit because we get iodine from soil, and the amount of iodine in the soil in Ireland is different to the soil in Australia, and you get my drift. Now, we're not eating soil, but the cows that we get our dairy from are grazing on that soil, and the vegetables are grown in that soil. And in recent years, I've definitely seen not getting enough iodine becoming more of an issue. And a recent enough Irish statistic showed that 1 in 4 adults were shown to have below estimated average intakes for iodine. And this increased to 3 out of 4 in women of childbearing age. And you might be wondering why this is. Well, I would say it's because iodine is not in many foods. The main sources of getting iodine are dairy, like your milk, but now it's more trendy to have almond or oat milk, so people aren't getting as much iodine as they used to. The other big source is fish, and I know a lot of people who just don't like fish and don't eat it. And another good source is seaweed, but like really, who has seaweed on their weekly meal night rotations? So if you're not drinking milk anymore, if you don't really like fish and you don't have seaweed, you're probably more at risk of not having enough iodine in your diet. And in this situation, it may be worth having it checked, which is done using usually a urine sample. Now, I do want to advise that I don't blindly recommend that you start taking an iodine supplement, because too much iodine can actually be harmful. So it's not something that you just willy-nilly grab off of the pharmacy shelf. It can actually worsen thyroid issues if you take too much. And iodine is also very, very important in pregnancy. And you need a little more iodine than normal when you're pregnant to support the development of your baby. So if you are pregnant or you're planning to get pregnant and you're taking a prenatal supplement, you want to make sure that it has iodine in it. Some of the main big ones don't. So it's something to look out for. Then we have selenium and zinc, and these are really important to convert your thyroid hormone into its active form. And again, recent statistics in Ireland showed that nearly 1 in 2 Irish adults did not meet the recommended adequate intake for selenium, and nearly 2 in 3 participants are at risk of an inadequate zinc intake. So for selenium, one of the best sources is Brazil nuts, and just 1 Brazil nut a day will give you enough selenium. It's also found in seafood, eggs, and sunflower seeds. But again, you don't need to be going overboard here and eating a handful of Brazil nuts every single day, because too much of a good thing isn't a good thing. Then zinc, it's mainly found in your animal foods like your meat and your dairy. But there are also plant-based options like your fortified cereals, and pumpkin seeds also contain this mineral. Now, nutrient deficiencies are also common in people with hypothyroidism, particularly B12, vitamin D, and iron. And if any of these are low, you are pretty likely to feel tired and pretty crap. So it is important to get a baseline check on these and make a plan to fix the deficiency if needed. Now, I'm not actually saying to avoid these, but goitrogens are typically feared amongst thyroid patients. And goitrogens are compounds which have been found to interfere with thyroid function, but only if there is already a thyroid dysfunction, an iodine deficiency, and or the foods containing these compounds are consumed in like really big excessive amounts. So I just want to re-emphasize this. If your iodine levels are normal, you do not need to fear these foods. So the first group of goitrogens that typically comes to mind is your cruciferous vegetables. And these are things like your bok choy, your broccoli, your cauliflower, your Brussels sprouts. I'll leave a list on the screen. And all of these foods really are very good for your general health. So again, if your iodine levels are okay, I don't think you need to be avoiding them. I just wouldn't be eating them in excess either. But the good news is that if you cook or steam these cruciferous vegetables, it seems to denature most of that goitrogenic effect. And I don't think that many people are going around eating raw broccoli and cauliflower anyway. Now, another category of goitrogens is your soy-based foods. So for example, your tofu, your tempeh, your edamame, and your soybeans, or your soya milks and your soya yogurts. But again, if you have normal iodine levels, there is no cause for concern. And then there are certain fruits, like almonds, apricots, and cherries, peaches, pears, plums, raspberries, and strawberries. Then certain starchy foods like bamboo shoots, millet, sweet potato, and cassava, and certain beverages like coffee, green tea, and red wine. All of these contain goitrogens. But usually, again, if you don't have any iodine deficiency, there is no immediate cause for concern. The only exception to this is the millet, where it has been found that even in the absence of an iodine deficiency, it can suppress thyroid function, and therefore choosing an alternative grain is recommended. But the goitrogen in some of these foods that I've listed are what we call flavonoids, which is an antioxidant that is good for your health. So I really don't think you need to be scared of or avoiding these. Just be careful of any supplements that may contain these compounds or excessively large amounts. Now, there is also research to suggest avoiding alcohol if you have an underactive thyroid. And this is because alcohol can affect virtually all aspects of your thyroid gland. Therefore, avoiding alcohol or drinking in moderation is recommended. And it's just a general healthful thing to be doing. Now, it's important to note that no specific diet is currently recommended to treat Hashimoto's disease or any form of an underactive thyroid. And just because something works for one person doesn't necessarily mean it's going to work for you. And this is one reason why self-experimentation is important. But there are two popular diet plans that people like to follow when they have an underactive thyroid. And the first one is following a gluten-free diet. So remember, if you watched the earlier section, I said that if you have one autoimmune condition, you are more likely to have another, like celiac disease or type 1 diabetes. So it is more common for people with hypothyroidism to also have celiac disease. And in this situation, if you have celiac disease, it is recommended to transition to a lifelong, strict gluten-free diet. And this will help regulate your thyroid hormones and make you just in general feel better. However, if you have not been diagnosed with celiac disease, avoiding gluten will not aid in the treatment of your underactive thyroid. What I would recommend is, if you really suspect gluten to be a trigger, speak to your doctor and try to get a proper diagnosis, because it's very important to know if you really do have celiac disease. And to properly investigate this, unfortunately, to be the bearer of bad news, you do need to actually bring gluten back into your diet, and you need to be eating gluten, at least 2 slices of bread every day for about 4 weeks before you actually test to see if you are a celiac. If you don't eat gluten and then get the test, nothing will show up because there's no gluten in your system when you get checked. But if you have been checked, you have no issues with gluten, I wouldn't be unnecessarily cutting it out. Following a gluten-free diet is quite difficult, and it may just be unnecessary stress if it's not needed for you. Now, the other popular diet is the AIP diet, or the Autoimmune Protocol diet. Now, this is an extremely restrictive elimination diet, and it is sometimes recommended to those who suffer with autoimmune conditions. And its goal is to reduce inflammation by eliminating proposed foods that cause inflammation. But the issue is that it eliminates a huge list of foods. And while the people who try this diet, they might feel like there is potential benefits, it is important to note the drawbacks of such a restrictive diet. And not only is this pretty unrealistic for most people, it can also cause nutritional deficiencies, which isn't going to be good for your thyroid either. It can also lead to unintended weight loss or a risk of disordered eating or a poor relationship with food. And most importantly, there is no solid research backing this protocol diet. I found one study that did track participants with thyroid disorders who followed this AIP diet, but they found 0 improvements in thyroid labs. However, they did find a slight decrease in inflammatory markers. But we kind of know this already. If you eat just a generally more healthful diet and less processed foods, you will experience less inflammation. But you don't need to go to extremes like this. In fact, I have another video where I go through a much more practical anti-inflammatory diet that will be much easier and better to follow. And most importantly, the AIP diet is not supported by the American Association of Clinical Endocrinologists. Now, if you really do wish to give this diet a try, please make sure you do so under the supervision of a dietitian. They will be able to help you bring back in foods after you have eliminated them and monitor for any nutritional deficiencies. So I think really what's the best diet to follow is just your general healthy eating diet, like a Mediterranean style eating pattern, for example. And that's what I go over in the anti-inflammatory diet video. Now, diet is only one piece of the puzzle when it comes to supporting your thyroid health. You need to be equally trying to manage stress in the body by getting enough sleep and regularly de-stressing. Exercise is also hugely important. If you're wondering which type of exercise is best, there really isn't a consensus. I would say a little bit of everything to cover all aspects of health, but you can also let your symptoms guide you. If you're feeling particularly fatigued some weeks, those are the weeks that it would probably be easier to do something like yoga or something a little bit less strenuous on the body. So the bottom line is that there is no best diet for hypothyroidism, but eating the right nutrients and taking your medication properly can help manage your hypothyroidism symptoms. Now, if you enjoyed this video, definitely check out the anti-inflammatory diet video. But I have a feeling you'd also enjoy my video all about food cravings, which I will leave linked on the screen here. As always, that was a long one. Thank you for making it all the way to the end with me. I have a free recipe ebook which I have left linked in the description box below. And stay happy and stay healthy, and I will see you again next week. Thank you for watching.